Okay, we'll go ahead and call the meeting to order. Policy and Procedure Committee on Thursday, May 28th, 2020 at 9 a.m. We call the roll, please.
Barron.
Here.
Paul.
Here.
McTaggart. Awful. Here. Sigmund.
Here. Here.
Sure.
Yep. Okay, you have a copy of the agenda in front of you. Is there a motion to approve? Mr. Alt, is there a second?
Second.
Mrs. Awful seconds. Are there any questions or comments regarding the agenda? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. That motion passes. Do we have any public comments this morning? Seeing none, we'll move to the committee chair reports. Mr. Barron's Management and Judicial.
At this point, we're just gonna do normal and judicial, normal reports. Management is just gonna be basic reports. Nothing much has been going on with everything, so.
Okay, in terms of management, it'd be my recommendation that you meet here in a manner similar to what we are right now as far as the social distancing and so forth. As far as the judicial committee meeting goes, I spoke with Mr. Devine to where you might be able to hold that meeting, and as yet that hasn't been resolved.
Okay.
So I think that's something after the meeting, this meeting, we can maybe have a little further discussion about that.
Maybe if they're not having anything in the court,
No, but we can have that discussion afterwards, okay?
okay.
All right. Mr. Sticklehouse, Tax Committee.
At this point, I don't have anything on my agenda. It'll be just the regular committee department head reports.
Okay, in your case, the recommendation is also is to meet here in a manner similar to what we are with people spread out like we are right here at these desks and so forth, limited to 10 people.
Will do.
Okay, Mrs. Awful Health,
We'll have this basic report also.
thank you. Same thing applies for you.
Yes, sir.
Okay. Mr. Alt, Highway Committee.
We have nothing at all to report except the claims. Joel and I thought maybe if you would put in the claims, the county board would be able to have a meeting.
Well, you're gonna have to make that decision pretty soon.
We brought it up to you before we made the decision.
Okay, well, one option is also to present the claims at the Finance Committee meeting next Thursday.
What's that? We could do that.
Oh, that'd be something to keep in mind. We can discuss it further after this meeting today and try and arrive at some decisions, okay?
Yeah, fine.
Okay, Mr. McTaggart, Finance and IT.
We had, I guess we were gonna look at, things with the budget and start looking at things for 2021 budget and what was, look at what our options are with employment and those kind of things. As far as any savings or salaries and all those kind of things, but start looking into those kind of figures and projects and things that we can hold off for next year, I guess, or things maybe we can avoid. Mainly budget type things.
Okay. I'll forego the chairman comments this morning. We'll move on to the EMA report.
EMA has been primarily focused on COVID-19. We've been continually distributing resources that we've received from both donations and from the State Emergency Operations Center. Time devoted to other projects has been extremely limited. However, we are progressing on our mass notification system as budgeted for this year. As you all know, contract has been signed, bill has been paid, and now we're getting the GIS data to that company so we can get a system up and running. We had some storms over the last weekend where I set off some warning sirens. I don't believe we had any damage from those storms, but I was paying attention and we did warn some people. And I think that's pretty much it. Unless anybody has any specific questions, if you have any specific questions about EMA activities for COVID-19, I'd be happy to answer them.
Okay, thank you. Next, we'll move on to the Senate Bill 75. Mr. Munyon, would you come up and give us your report?
That handouts, you want me to lay them down for people to pick up or? pass
Um,
them over?
I'll open up that. Make sure the microphone is turned on.
Should be a simple switch in the top. One second.
I don't know if it's on or not.
Go ahead.
Is it on?
Get really close to it.
Oh, I know. Yeah? Is it on? There we go. So basically, this is just a handout, what we got here. It came from Bliss McKnight, talking to Tim Drury on, he's the risk control manager for the insurance company. And it's just updates that says that the health department has come out with their version of what they have for getting us qualified for being compliant with the bill. They're also saying that what they have is sufficient, and actually they feel that it's a better option for us, and it's all free. So there's a recommendation that to get it started, that we have like a plan going forward, and maybe one person that would be handling who we are going to train first, and then have, records of how we make sure that each department is taken care of, and everybody within that department, and then we can make arrangements to move on to the next one so that we can make sure that nobody gets missed. So there's 3 options that are available for you through Bliss, and they're all free. So the first option is that he's willing to come down within regulations and social distancing and do a live training per department, no matter how many members you have, several of them. And we can make arrangements according to schedules, whether it's a night shift or a day shift, first, second, or third. We can make arrangements to make that happen. That's the first option. The second option is, and this is the recommendation of Bliss, is that we do like a Zoom sort of meeting. It's similar to it, but it's a lot easier to deal with. You can get more people involved. It's a question and answer thing, so that it's interactive, and that you can get a lot of people done in a short amount of time. We haven't really put an exact time frame on it, but we feel that it's in between the 40 minutes to not quite an hour. And so we're right in that 40 to 50 minute per training. So that's something that if we decided to go that route, we could do, like, let's just say, for example, like a 9 o'clock, a 10:30, a 12, spread them out and do so many, so that in case that you have people working in that department, you don't drain that department. You can do so many at a time. And then you can do multiple departments at once, but however your grouping is to line up for training, we can make that happen however that works for you. We're willing to work with however you guys can supply us with the people that need to be trained. And we feel that's the best option. It's probably the easiest option for everybody. It's going to be the least cumbersome one. And then the final one is similar to the health department, where you would have a username, password. You'd be able to go online from any computer, and you would just hit on a link, and then you would have to do the training. It would be more like a webinar, and that you would there would be no question answer there. It wouldn't be a live training, but it's there and it's available, and we can do all 3 of these in any different way. But the last one we feel is like if you have a late hire come in, or somebody that you want to get qualified to get through this training so that you can get it on your record. So basically, that's where we're at. So we're willing to work around your schedule if you have any kind of idea of which way you want to go, live, Zoom, or if you want to set up with the other ones, just let us know. And then we'll make all the accommodations for you. We can get started whenever you're ready. We're ready to go live.
If we were gonna do the live training, we really have until the end of this year to get it done, is that correct?
Yeah, they pushed it back because of the whole thing. But
So it's entirely possible that the social distancing and so forth would be somewhat non-existent at that time.
that's possible. I think that it would probably make sense to start on it as soon as possible. To try and get it knocked out, because we don't know if maybe there's gonna be a second wave or something, so I think that if you have a large amount of people that we're trying to do and work around schedules, the sooner the better in ours. But we'll work around you.
Yeah, well, I guess my concern, I'm not sure if others share it or not, but my concern with the Zoom approach, I've been involved with a number of these already. Zoom and just the telephone things, I've yet to see one that worked good.
Yeah.
There's always somebody, one or two that are not able to make the right contact or to participate in the proper way.
Right.
And so I think that would be the concern with that. Otherwise, it does seem like it's an excellent tool, but for some reason, it isn't just us. I mean, there's others. I'm involved with the people in Indiana, and they have similar problems. I watched last night the Kankakee County stuff, and they're on Zoom, and they got board members up there that they can't communicate with.
Right, and I think a lot of the problem that I've done a multitude of them myself. Tim has said that he's been doing them for small villages already, and that he's had very good success with it. I think a lot of the problem runs into the ones that I've been on. I've been on one of them with Mr. Bennett, and it's a internet problem where somebody can't get logged on, or they fade out, or they come back on. And I think that would probably work better if you had some of your employees that, let's say you did a Zoom meeting in here, where you had, social distance in here, and you had a good internet system set up. And then you wouldn't have that fade and then the relaunch. But also that last option would be available for somebody that got kicked off, was trying to do it somewhere, and then, as long as we had no, documentation of this person didn't get qualified because the Zoom didn't work for them. But we're willing to do whatever and whenever. It's up to you guys.
I think the last option is one of the ones that we need to adopt no matter what, because we have new hires all the time.
Right. Yeah.
That have to be trained. So
Right.
we're gonna have to have that ability to do that.
Yeah, and that's where I locally would come in and help set that up and make sure that you had everything you needed and get your password, username, and then walk you through that no matter when it is.
Okay.
You can do that.
Anybody on the committee have any thoughts as to how you think we should proceed? Mrs. Shepherd?
I'd like to make a request that the health department be one of the first to be trained, because our nurses have nursing licenses that are up for renewal, and one of the contingencies of renewal for a nursing license is sexual harassment training. And they're anxiously waiting this, and we've been waiting. So would it be possible to schedule something, very soon?
But if it's okay with you guys, we're ready to go.
Okay,
That's something that we'll.
I'd like to
go
get
through.
something set up with you before you leave today, if that's okay, with Chairman Scher. Is that okay, John?
And you also said that you come down and do like one day, but do multiple shifts of training.
Yes, yeah.
That might be something that we could,
For the health department, yeah, we
Yeah.
could.
Well,
for the whole.
Yeah, I can make arrangements for my staff I'll make it a mandatory training, and they all have to be there, and we'll do them all at once.
What is the deadline for what you're talking
Well, the
about?
nursing licenses are due, in 2 days, so most of them, not all of them. But some of the nurses have already renewed their nursing license and have taken an online training through the Illinois Breast and Cervical Cancer Program, which is an IDPH program, but it's not the same training that he's talking about.
Right.
It's not as comprehensive, and so I'm going to require everyone to go through the entire comprehensive IDPH program that he's willing to do. So what they've done so far has gotten them by, but it's not the comprehensive training, and I that's important. So.
Agreed. Also, the state still has theirs up. I mean, it's ready. They say it's ready, but it's live, and that's something that they can do individually. And it's
Usually
free.
they put those programs into a system called iTrain, and it's not in there. I looked yesterday for something else and was looking, and then while I was in there, thought I'd look, and I didn't see it in iTrain, but, so I don't think it's up yet, but I think, you know, at one time we were told that it would eventually be in iTrain, so I don't know.
Yeah.
But I'd like to have that training for my staff as soon as possible.
Well, then maybe before you leave today, we can set a date, and then I'll go ahead and make something up with time slots. That way we only keep the 10 people per training session, and we could just knock out a bunch of people one day if that'd be okay.
Yeah, and also, if you have anybody within the next couple days, if you give me your contact information, I can get you set up with the online for the individuals that are expiring in 2 days, and they can do it. Takes an hour. You know, they could get it done and get qualified.
Great, I'll give you my email address, if you can just send that to me, I'll distribute that out to my staff, and we can do it that way as well. I'm okay, as long as we get the requirements met.
We're flexible. We're willing to work with whatever you guys.
Yeah, we're flexible too. We appreciate you.
Okay, I'll go back to what I said. Does anybody on the committee have any thoughts about how we should be best way to proceed with this?
I think the Zoom works pretty good. Just get the kinks out of it. Some people that haven't used it yet don't know how to use it, so I don't know.
I mean, I agree with you, Barb, but the point is, there will be some that won't. So we just need to, if we're gonna go with the Zoom, we need to have some means in place to handle those situations.
Do you think it would be a good option to offer it live if you're willing to do that? I mean, I know everybody's a little sensitive about it, but is it okay if you think about the people that might not want to do the Zoom, that might struggle with it, that we could offer the live to them and they could sign up for that and get them done, and then get the more tech people into the Zoom? Is that an option?
Well, I think there's a number of things that we could consider. I don't know all of the exact numbers, but like, for example, we're contemplating having our county board meeting out at the highway department in the garage because there's a big space there. We can set some tables up and get people spread out enough. So I'm not sure if we can accommodate 30 people there at one time, but it's probably going to be somewhere in that number that we're going to need to accommodate. So that might be one option. I imagine we could accommodate 20 people pretty easily in this room, spread out as we are. You know, we've got 10 people in here right now, and I think there's probably room for another, another 10 people. The only thing is, according to the rules that are in place right now, we're not supposed to have more than 10 people together at any one time in any one place. Until that changes, I guess, you know, we have to decide, are we going to be bound to follow those guidelines and rules, or are we going to not?
I'm going to follow the rules that you guys tell me what you want to do, and
Well,
we'll do it.
My feeling is to follow the rules, but nevertheless, you know.
Is it possible when you're doing the live trainings to also have Zoom set up so that people can be involved in that at the same time or not?
I'd have to ask Tim on that because it's when you're doing the Zoom, you're putting up the slides on the computer, but
That's a good way to kill two birds with one stone.
Yeah.
You can have people live in
and do the Zoom at the same time. Yeah.
Well, since we're gonna set up the online anyways for new hires, we could do the day session where everybody that wants to come in or could come in sessions, get them done right away, and then whoever's not comfortable coming in, they could do the online training.
I think with all the options, it's just gonna be a matter of you
Yeah,
guys
we can
coordinating something.
coordinate, for
People
sure.
just have to figure out one way or another to get it.
I think once we do the first round, it'll start to become
Yeah.
a little more fluid.
So do we need a motion or just?
I think it's appropriate to have a motion, and if you want to have the motion, for example, to be that the health department work with them, and for Jill to work in cooperation, collaborating with the health department, and dovetail in the county employees and see how that works, that makes sense to me, I guess.
Did you get all that, Jill?
Yeah.
Okay.
Is that your motion?
Yes.
Okay, is there a second? Charlie seconds. Does anybody have any questions about it? All in favor, say aye.
Aye.
Opposed, same sign. That motion passes. Thank you, Myron. The other part about we talked about doing some updates to our HR manual. Has there been any progress done with that?
I think we are waiting on some documentation from the current manual. At last I heard, I mean, we kind of got sidelined with this whole thing.
There's a lot of things that have been sidelined. That's a lot.
I'll follow up with Jill on.
Okay. Okay, we can look at that next month then.
That sounds good.
Okay. You're gonna leave now?
I can stay if you'd like me to.
No, we'd like you to leave. There's somebody waiting out in the hallway, send them back in.
All right, I'll leave my card with you, and then I'll be in touch with you.
Okay.
Thank you, everybody.
Specifically, Lisa Nash,
Pardon me?
county clerk. Tell her to come.
Okay.
Thank you so
Yep.
much.
Then just send me some information, I'll get with back with you today.
Thank you.
Right.
Is there a reason she can't have the door open and listen for the president being listening?
Split hairs. Why split hairs? Do it clean.
I'll sure be glad to get out of this meeting so I can go to Walmart where it's safe.
Oh, yeah.
Okay, next on the agenda is the discussion and action on the EMA director's assignment to prepare the contingency plan.
All right, folks, good morning. Before you on your desk, you have something called the Iroquois County Recovery Plan for COVID-19 pandemic. Started this process, you remember the motion was to create a contingency plan should the governor's plan be ruled unconstitutional. And in doing so, we need to make sure I work with the health authority, which would be the Iroquois County Public Health Department. So my first step was to meet with State's Attorney Jim Devine, Chairman John Scher, and Public Health Administrator Deanne Shipper to figure out what authorities we have and don't have locally on the Iroquois County level. You see a mission statement, 5 objectives, and a couple of authorities listed on the front page. On page 2 is a simple table of contents. And just looking at the table of contents, you can see how far I go, and you can infer how far I don't go. There are isolation and quarantine procedures. These are already defined and already in place outside of the pandemic that the health department already does for numerous situations. Correct, Ms. Shipper?
Correct.
After that is manufacturing, a section called manufacturing, processing, retail, personal care, and other industries. When you're looking at this, you notice there's nothing that says required. I would like to actually make one edit. I just noticed on the top of page 4, replace the first paragraph with the following recommendations are. The first paragraph I shouldn't have put in there.
Darren,
Yes,
can we go back to page 3 for 1 second?
yes.
I just want to point out to the committee that this is just a summary of isolation and quarantine. These are not this is not the Iowa admin code, okay? This is just a summary. I just think that's important to point out.
Yes, thank you.
Would you repeat what you said we're supposed to cross off on page 4?
Yes, page 4, the top paragraph, starting with practice social distancing pursuant to, so on and so forth, ending with, this means your employer should. Please just cross out that paragraph. I shouldn't have put that in there.
The whole paragraph.
Yes, not the bullet points, but just that paragraph. And replace with the following recommendations are.
What if someone on page 3 says no? What do you do?
Okay.
What is the law?
So the law is that if the health department deems that that person is a risk to the public. Okay, let me start at the beginning. Someone who, let's use COVID-19 because that's what we're dealing with. So if someone tests positive for COVID-19, they're placed under isolation. Isolation has specific requirements and criteria for that person. Do you want me to go through everything with you or just the basics?
No.
So the basics are that you isolate your ill and you quarantine your known direct identified contacts. So if someone is placed under health department mandated isolation because they tested positive or quarantine because they are a known direct identified contact, then they have specific timelines and criteria that they have to remain in isolation or quarantine. If those people choose not to, or do not voluntarily consent, and so far, everyone that we've dealt with has voluntarily consented except for one. And they voluntarily consented for a while and then changed their mind. So what happens with the people that don't voluntarily consent, we spend some time trying to educate them on why it's important that they comply with isolation or quarantine. And to be honest with you, most people are not interested in hurting other people, so they will voluntarily comply. If they do not, the law says that we can seek a court order. That's been done before with tuberculosis patients, with mumps cases, with people who have meningitis. That's not a new health department concept. This quarantine and isolation has been around since the beginning of my time in health department. I've worked for the health department for 28 years, so this is not a new thing. Everybody is just upset because now it's happening to more people. Would I seek a court order if someone is a known direct contact? I may. It will depend on the circumstances. I've talked to Jim Devine about it. Some things are, have to be left to a determination of what kind of risk they are. But yeah, that's definitely possible. And if I have someone that's under isolation and they've tested positive and they are, continuing to go to a big factory to work or whatever, yeah, I'm going to seek a court order. It could happen. Whether I get that court order or not is up to the judge, and up to the state's attorney who wants to take it. But yes, I may do that. That option is there. People really don't have a right to hurt other people.
If I might add on top of that, the authority for that lies in what's listed on the authority page on page 1, 20 ILCS 2305 B and C. And that is something outside of the pandemic, like Ms. Shepard said. It's been around for quite a while.
Can we go back to page 4 and tell us what we crossed out the top paragraph there? Are we putting something in its place?
The following recommendations are.
That's it?
That's it.
What was that I didn't hear?
Replace the top paragraph on page 4 with
Okay, got that.
the following recommendations are.
better.
Okay, thank you.
Okay. Now, I'd like to point out the key word is recommendations. And, you know, when looking at plans such as Governor's Restore Illinois plan and the other plan that some other counties have put together and has been recommended, called Back to Business Illinois, there are a lot more specifics. We determined that we don't have the authority to implement and require a lot of those specifics. So you see we have recommendations straight from throughout the plan, the Illinois Department of Public Health, and mostly the CDC, the Center for Disease Control and Prevention. Moving on to page 5. Is food establishments. I'm going to give you a minute just to take a look at it. The food establishment section is a few pages long. Would you guys like some more time, or would you like to talk about it? Silence means you want to move on. Okay, I'll just say once again, outside of normal daily operations, there's no additional requirements upon food establishments. There are a lot of recommendations here. What you see on the first page of the section, you know, what is lowest risk to what is the highest risk in terms of operations. There's a lot of guidance on how to reduce spread in an establishment, both if it comes in by a customer or by your employees. Some recommended supplies and sanitation methods. Housing stuff, water systems, ventilation, physical furniture, recommendations of those things that you could do to limit the spread of COVID-19, so on and so forth. Any questions, comments, concerns about the food section? Okay, next session is on page 13, social gatherings and communities of faith. This section was pulled directly from the Center for Disease Control and Prevention, and it gives numerous recommendations on how to safely gather and sanitation methods, including what kind of face coverings are recommended, social distancing recommendations, minimizing common contact areas, whether it be a coffee bar or water fountain, so on and so forth. Have you guys a minute to look at this?
Excuse me.
How is it safer if, so let's say the governor magically on Friday said that churches could have outdoor services now. If a church put up a temporary tent that just protected them from rain, how is that any more safe than an indoor system with good ventilation? Or less safe or whatever?
So one of the things that they know is that because of the size of the droplets of SARS-CoV-2, which is the virus that causes COVID-19, the disease, we know that it's very, very small. And because that's very, very small, anytime that you're outdoors, the wind can circulate. So it's probably, it takes the virus away from people. So, outdoor activities are safer than indoor activities. And there's a ton of research out there that are scientific based that shows that outdoor is safer than indoor. So whether this is appropriate or not appropriate, I'm going to say it. The best article I've read so far throughout this whole pandemic came out in Science Magazine recently. I this morning posted it to my personal Facebook page. I did not put it on the health department Facebook page because it's not been recommended by IDPH. It's not been backed by them. But it is a scientific-based article. It's actually pretty good. It lays it out in layman's terms. It's a short read. It's probably the best thing I've read so far. Hop on my Facebook page. I'll make it public today since this is public and being recorded. Read that article. It's really it explains how this virus is different than other, flu viruses, and part of it's just, based on the molecular weight of it. It tends to, when people breathe it in, it tends to float down inside the alveoli of the lungs rather than staying at the top of the lungs. That your immune system doesn't really have anything to do with your alveoli. So, it's very scientific based, but it lays it out in pretty good layman's terms. It's worth the read, but it explains some of the why behind the what, and that's what I put on my Facebook page. This virus is definitely different than any other virus that we've seen, and it affects people differently. But it's a good read. Read that. I'm not, saying it's the gospel or the Bible by any means, but so far, it's one of the best ones that I've read.
So what you're saying, if I understand it to Mr. McTaggart's question,
Out, put fans in them, it would be the same.
if you were outdoors without any tent covering, that would be the safest. If you had a tent with the walls up so that wind or air could blow through it, that would be the next safest.
You want to be.
But if you have the walls of the tent down, it's probably about the same as being indoors.
Right, because you're going to have the highest concentration of the virus in an enclosed space. The more space there is for that virus to travel, the less likely it is that people are going to be inhaling it.
It doesn't really matter. We're splitting hairs.
I think one of the
If you knocked
things,
all the windows out and it could have more ventilation than a tent, I mean, we're subjective in each situation.
I think it's been pointed out, and this holds true for restaurants and bars as well as churches and other similar places, is that where you have an air conditioning system or heating system where you're recirculating the air, you're continuing, the virus will continue to be circulated along with it. So, I mean, that's something also to take into consideration. I guess my thoughts are, in looking at this, obviously not having an opportunity to really study each item carefully, but it looks to me like a lot of the bases are covered here, maybe most of them are. And basically, these are recommendations. They're not requiring anybody to do anything, and I think that's probably the best way to summarize the county's position on this matter. I don't think the county has any authority to tell people what to do. I think we probably do have a responsibility to provide recommendations and guidelines to people, and I think that's what this is accomplishing. So I think from that standpoint, it's also worthy to note that if we were to go ahead and approve this, it still is something that can be amended from time to time if and when the need shows itself. So with that, I guess I'd welcome anybody else's comments. Do you think this has accomplished the purpose by which Mr. Stacy was given this assignment?
Just to note that my directive was to work with the health authority, being the health department, so of course it's exactly what I did. So all of this came through the health department. And Dee, I'd like to give you the opportunity just to make any comments, anything at all.
No, I think Chairman Schur was correct. These are, guidelines that we would offer the citizens in the places of employment, the businesses within Iroquois County. I get phone calls every day from county businesses wanting to know, what's the safest, how can I protect my employees, myself, my employees, and my customers. I get those phone calls every day. So, I go over the guidance with them. To be honest, most of it's just common sense hygiene practice stuff, If a flu's going around, there are people who wear masks, Masks are a good way to prevent the spread of this. They really are. No, they're not 100%, but they definitely help. We tell people to sneeze into a tissue, We tell people to sneeze into their elbow. We tell people to wash their hands frequently, to social distance, to stay at home if they're sick. It's common sense stuff. This isn't really rocket science. It's common sense things. And those are the guidelines that we are asking you to consider us recommending. But ultimately, these are common sense things.
Which I've seen some quite a few people don't have.
That's true.
I think one thing that may be important for us to also keep in mind or consider in this, and I'll bring it up now, it's maybe not directly related to this, but Mr. McTaggart pointed out to me yesterday about some activity that occurred at the Kankakee County Board yesterday, and I took an opportunity to look at the video of that meeting last night. I didn't have a chance, unfortunately, the meeting lasted so long and I fell asleep before it was over. But essentially, it was pointed out numerous times by the county board chairman as well as some of the county board members that they do not have any authority to override or open up the county per se, as the people are asking them to do. What they put together is a plan for reopening the county that they intend, if I understand it correctly, they intend to submit this to the governor and ask his approval. They're concerned and not very happy because in way that the governor divided the state up into different regions, they got put in with the Chicago region, and they're not real happy about that because they feel like that the results up there are different. And the county board chairman up there presented numerous tables and graphs showing the incidences that have occurred in Kankakee County versus the other counties that are within their region. And almost every one, Kankakee County ranks near the bottom or very near the bottom. And that's part of what their hope and intent is. But excuse me. So anyway, what I got out of it was that they're planning to have a special county board meeting either Monday or Tuesday of next week, and they're going to consider this resolution that they put together. I would expect it probably will be amended further. That's one reason why I don't know that we can look at it as being an absolute fact just yet. I think it's something that the main thing that stood out to me was that they acknowledged the fact that they're going to present this to the governor and ask to be removed from that region and ask that they can open up their county or actually put their county in the governor's phase 4 on June 8th. So they're still going to adhere to the governor's plan. They just want to move into phase 4 on June 8th. That's basically what they're wanting to do. But they're asking the governor's permission to do that. So to me, that's very significant. Another thing that's significant to note that relates to this is that on Tuesday, the Edgar County Board met and they issued a statement that was also very telling. And in summary, they said that they do not have any authority to reopen any businesses in Edgar County because they didn't close them down. They said it was the governor that did it, and that's the only way they can be reopened. And they said that they have written to the governor on asking permission to do that, and they haven't gotten any answer. But I think that to me, the part that's most significant is that they just as we acknowledged at our last board meeting from the advice of our state's attorney that we do not have authority to do some of the things that people are asking us to do. And so I think that we need to keep that in mind and operate within that framework. So I think, again, I'll get back to what Eric has put together. To me, it looks to me like it's accomplished the purpose and the assignment that he was given, so.
I move that we send it to the full board for approval.
Okay, is there a second?
I'll second the motion.
Okay, is there any further discussion? Would you call the roll, please?
Beers?
Yes.
Paul?
Yes.
Taggart?
Yes.
Awful?
Yes.
Stickler?
Yes.
Sure.
Yes. Okay, that motion passes. Thank you, Eric. We'll move on to a discussion and motion to amend the food ordinance. This was passed out to you a few minutes ago. Mr. Shipper, would you come forward and explain what this is all about, please?
Sure. Thank you. The Iroquois County Public Health Department feels that businesses, especially businesses that are attached to the Iroquois County food ordinance, the ordinance governing food service and sanitation, those businesses have had a hard enough time lately. And we do not want to add to their burden in any way, shape, or form. So the food ordinance, if you turn to page 5, so at the top it'll say page 5 of 13. At the bottom, there should be a yellow highlighted sentence. The food ordinance says, if a restaurant or retail food store closes for more than 1 month, a new permit must be obtained before the establishment may be reopened. The Iroquois County Public Health Department requests that the county board waive this portion of the food ordinance during the COVID pandemic. There are restaurants that have shut down, completely shut down, that are not doing curbside drive up during this time, and we do not feel that it is in anyone's best interest to charge them, to require that they have a new permit, or to charge them the fees for a new permit, for something that they had no control over. So we would like the county board to waive this portion of the ordinance during COVID-19. In addition, if you will turn to page 8 of 13, under Part 3, Section 1, Inspection of Food Service and Retail Food Stores, the first sentence says, at least twice per year, the health authority or its representative shall inspect each food service establishment and retail food store located in the county of Iroquois. Iroquois County Public Health Department is also asking the county board to waive that as well during COVID-19. We will still meet the FDA food code, the 750 code, and our local health protection grant, because they all say that a high-risk establishment will be inspected twice, and we will continue to do that twice a year. A medium risk once a year, and a low risk every other year. We will still meet those, but what we're asking the county board to waive at this time is that all establishments be inspected twice per year. We know that as we handle complaints and reopenings, that we're going to get tied up doing a lot of extra visits for some places, but we also may have places where we don't have to do that. So we still want to be able to meet the FDA food code, the 750 state code, and we still want to meet our local health protection grant requirements. But we're asking that during COVID-19, the county board waive that sentence as well. So there are two sentences we're asking the county board to waive during this time. It will help these local businesses, take a lot of pressure and stress off them.
Okay, I'm confused. You say on page 5 about not requiring a permit. I understand the idea of not charging them, but are you saying there's no inspection going to be done?
No, that's not what we're saying. We're saying that
if you do an inspection and they pass the inspection, in essence, that's giving them a permit to reopen, isn't it?
no, that's not how it works. So if a restaurant so the sentence says, if a restaurant or retail food store closes for more than 1 month, a new permit must be obtained. Okay? So we don't have to give them a new permit to have them to do a reopening inspection. The permit is only issued once a year, and that permit is good throughout the year. So we're not asking, we're asking that we not have to reissue a new one because they've been closed for a month. They will function under their current permit. We'll still go do a reopening inspection and that kind of stuff. We're asking for the permit.
So if
Which has an associated fee with
Of
it.
$300.
Yeah. And that's what,
Yes.
I understand the fee part. So if we make a motion to waive this sentence, should that motion also include provision that there still will be an inspection made? So that there's no misunderstanding.
Yeah,
We're not going to allow
they
anybody
still
to.
have to follow
They
all.
still follow all the rules. We're just asking for them not to have to be issued a new permit and pay for a new permit. They're still gonna have, it doesn't change any other part of this whole big ordinance.
I understand that. I don't think you understand what I'm saying, is that if you waive this sentence says when you're closed for more than a new month, you need a new permit. That implies that part of the permitting process is to be inspected. If you waive this, so you're saying that the inspection, you're waiving the inspection part of it also. I'm saying that if we make a motion to waive this sentence, that we should include with the motion a proviso that the inspection still needs to be done that they won't be charged for it.
That's fine.
That way, there's no misunderstanding on anybody's part.
But you're still inspecting them at least every year.
Yes, yes. We were just asking for this sentence to be changed, not to,
Will they be
Any
inspected
other
before
part?
they open, or do they not have to be?
yeah, anytime they're closed. If they're closed,
So,
anytime, like if they're closed for a week for a flood, you know, or 2 weeks or whatever, we had to go do a reopening inspection. That's in the rest of this. It doesn't change any of that.
Right.
That's what I'm saying. So yeah, they still have to meet all the other requirements. We were just asking for this sentence to be waived. Does that make sense?
Yeah.
then I will move that we waive the parts in the ordinance as mentioned for establishments directly affected by the COVID-19 pandemic, and not those that were closed for other reasons.
And,
Correct.
and do you want to make it two motions or?
Well, it'd be both of them that were.
Those were COVID.
Yeah,
Okay.
but just for COVID.
Yes.
Yeah, because you don't want it for somebody that was shut down because they were just bad.
Right.
And we are waiving the reopening fee. Correct.
Yes. Well, if we waive them from having to get a new permit, that automatically takes the fee away.
I mean, if you wanted to, per two motions, we can, but one.
Can I make a suggestion for a
Well,
motion?
Sure.
There should be two motions, one for page 5 and one for page 8, because they're two separate things.
Yeah, however you want to do it.
Okay, do you still have a suggestion or not?
My suggestion would be a motion to waive the sentence in the food ordinance that says, if a restaurant or retail food store closes for more than 1 month, a new permit must be obtained before the establishment may be reopened for businesses affected by COVID-19 only.
Just to make it easier for people to find, should we put that sentence is under part 2, section 1 permits?
Yes, that'd be fine.
And I will make that motion.
I'm still not happy with the fact that you don't say that they have to be inspected.
It already says that in the rest of it.
Okay.
But if you want that in there, that's okay. They still have to meet the rest of the food ordinance requirements.
I guess the point is, I think we all understand that here, but do the restaurants and others that are affected by that understand that? Are they gonna say, oh, I don't have to pay a fee, I don't have to get a new permit, I'll just open up and away I go? Do they know they're gonna have to be re-inspected
Well-
before they can open?
Yes, they do, and they'll let us know when they're reopening. Really, most of the restaurants are very cooperative with us. We know which ones are shut down. We you know.
I realize most of them are, I'm not talking about most of them. But most of them means there's some that don't.
However you would like the motion. I'm just asking you to waive that
How
part.
do you want the motion, John?
Can you read back what we have?
Waive the sentence in the food ordinance that says on page 5, I have to go there, I'm sorry. Part 2, section 1, but only for businesses affected by COVID-19 only.
I'm good with that. If you want to add something, I will entertain that being added.
I would just put in there, but a re-inspection is necessary.
Simple as that.
Okay. Then that is my motion.
Okay.
Is there a second?
Second.
Seconded by Mrs. Offenbach. Is there any further question or discussion?
Yeah,
Seeing none?
I have one.
Yes, sir.
It says if it's closed for more than 1 month, what if it's closed for 3 weeks? How does that affect?
Then it doesn't apply.
Doesn't apply.
Some of these places that may have been closed for several months now.
Restaurant and spot that might take this and bring.
2 seconds.
Okay, I don't know if do we need to call the roll? We're not spending any money. All in favor, say aye.
Aye.
Opposed, same sign. That motion passes. Now, what about page 8? Do you want to make a separate motion on that?
Okay, now, just so we get it right, what was your recommendation on that? Because you still have, it's not gonna be inspected twice, but it's still gonna be inspected how many times?
So we would resort back to the FDA food code, the 750, which is the state code, and the local health protection grant. And all of those say that, you know, a high risk establishment is inspected twice a year, a medium once a year, and then a low risk establishment is inspected every other year. So what we're asking is that the sentence that says at least twice per year, the health authority or its representative shall inspect each food service establishment and retail food store located in the county of Iroquois. We would like that sentence waived during the COVID pandemic. That gives us the option of, during COVID, a low-risk establishment, like, say, a little mom-and-pop gas station that sells prepackaged chips and cookies, from having to be inspected twice. It diverts the health department's staff from necessary and more important work to work that we would determine not a priority during the COVID pandemic. Do you see what I'm saying? Does that make sense?
Yeah, I see what you're saying. I'm just not sure I understand how we're gonna get all that reduced down to some verbiage. It's easy to say we're gonna waive that first sentence. I guess you're replacing it though with.
No, you don't have to replace it, because we already, as a health department, have to meet the FDA food code, which the county board has already adopted the FDA food code. The ordinance is stricter than the FDA food code. So we're just asking to waive that sentence during the COVID pandemic. That's all we need, because we've already adopted the FDA food code. We already have to go, the health department already has to go by the 750 IL food code. And our local health protection grant requires those as grant deliverables. So you don't have to even address that unless you want to. We're just asking the county to waive the 2 inspections per year for everybody during COVID.
So the similar motion could be made with the understanding that the required inspections per the FDA and state food codes are to continue.
Yes.
I don't even think you want to address, that's up to you, but I wouldn't address that, because it's already addressed. We're only asking you to waive that sentence out of the
I
ordinance.
think that they're just thinking in
Is there-
terms how much the actual business owners know about the entire ordinance.
They do, they know, they're educated. If you're running a restaurant or a food establishment or a license to sell food, you know.
No, I understand, I'm just trying to clarify.
Okay, so then I would move that we suspend, waive the sentence, at least twice per year, the health authority or its representative shall inspect each food service establishment and retail food located in Iroquois County. Under Part 3, Section 1 of the inspection of food services and retail food stores. For the
Duration of the
COVID pandemic.
Okay, is there any further questions or comments? you're gonna come back and tell us when the COVID pandemic is over to reinstate this?
Yes. Yes.
It'll automatically reinstate once it's declared over.
About 10 years now.
Well, that was a question I had, you know when it starts, how do you determine when it's over? At what point do you say the pandemic is over?
People were dying.
Back in the 1950s, polio was a pandemic, and is it over?
Well,
People still get it.
yeah, you still can get the flu, so there's gotta be some threshold that the health department uses. We don't need to go into that now.
Oh, please, let's not.
No, that's why I just asked. Dee's gonna come back and tell us when to reinstate this.
Yes.
Okay. Is there any further questions or discussion? If not, all in favor, aye. Opposed, same sign. That motion passes. Thank you very much, Dee.
Thank you.
Now, let's see, we move on next to discussion and motion to provide financial relief on license fees to Iroquois County liquor license holders. Do you have any comments to make about that, Ms. Fancher?
We have, everybody's fees, but we don't, cash those checks until they're all approved by the county board. But it would be no problem for us to go ahead and deposit those checks if you guys wanted to give them like a 3/4 of a year license, maybe give them a break on the first quarter of the year for us to, there wouldn't be any problem for us to reimburse them, send them back checks. I can't remember off the top of my head, we have like 7 or 8 liquor licenses currently.
Right, we've got them all listed here. I guess if I figured it out right, every month.
So the liquor licenses begin July 1st. July 1st? Is that right, John?
Yeah,
Does it say that on there? July 1st, yeah.
July 1st to June 30th. The total for the county is $6,050 in revenue.
So, it wouldn't be a,
So that's
it wouldn't be a lot, but it would
$504.
be a nice thing to do.
That's $504.17 a month. So if you want to give them relief for 1 month, it's what it is. The 2 months would be twice 504. 3 months would be 3 times $504.17 in lost revenue to the county.
Is it easier to give them a refund or to give them a reduced rate on the next year?
It wouldn't be difficult to give them a refund, and there are a couple that are specifically having a difficult time financially right now that could really use the refund. And we have in our ordinance where we can sell, a license at a quarter, of a year or half a year, and then there's an actual fee established for a 6-month license or a 3-month license or a full 12-month license. So we would just figure out I haven't looked at these for a while. So a 1 AM license is,
$700 for a 1 AM license.
$700 for a 1 AM license. $450 for a club, $950 for a 2 AM license. Round that up to 1,000. Yeah, for example, for a 2 AM license, that would be we would send them back around $250. If you were interested in giving them a break of a quarter of their.
Right, that's what I said. The total revenue to the county right now is $6,050 for all the licenses for 1 year. That works out to $504.17 each month, dividing the 6,050 by 12. So if we want to give them any rebate or break, this is what the reduction in revenue to the county is. It would be up to the clerk's office to calculate the exact amount for each individual license. I'm just looking at it in total because that's really what you have to look at it in total, it applies to everybody that has a license.
Are they partially open now or not yet? Or when will they be open? And, I mean, do we even know?
A lot of them are.
The governor just switched it. He said originally bars couldn't open until stage 5, which is, no one knows, maybe a year from now. And then he just switched it last week that bars could open at what, stage 4?
Look at 10 outside.
Or something, yeah.
I mean, do we even
I
know?
have to
So at a minimum, that'd be 4 months
I'd have to look at
from when all this started, which would be a third of the year. If we went to phase 4 at the end of June.
I guess we can give them a.
The original, when he made the proclamation at the end of April, no bars could open, indoor bars could open until stage 5, which was, we had to have a vaccine. And then he switched it magically last week that now it's okay at stage 4.
So when does stage 4 start?
Well, tomorrow's.
No one knows, but theoretically, he said as early as the end of June.
I think,
Stage 3 starts.
Stage 3 starts on Friday, and he has an arbitrary rule that's 28 days you have to be before you can start the next one, even though the rest of the nation's on 14 days.
stage
So
4
at
was
best, we
carrying
can
a
start
big
again.
shipment of gold and it got held up out here a couple miles out of town.
Your restaurants and the bars are really losing.
Well, I guess we could do a quarter, and then if we determine that we need to go another quarter or month, we can always extend that too.
I guess what I'm getting at is that as it sits today, which he seems to change his mind on what the rules are, often, the earliest they could open would be the end of June,
Okay.
which would be darn near 4 months.
Yeah, and it really wouldn't be that big of a cost to the county if you wanted to extend them. Just make everybody pay half of what they would normally be paying for a year. I mean, that's completely up to you guys, but that would be the simplest way. I think it shows a lot of, like empathy with them and support for
Because even then, I
support
don't
for
think
them.
they can fully open.
No.
I think there's a couple things we need to take into consideration, however. One of them is that the $6,050 of revenue that the county gets every year doesn't really cost us anything other than the time that it takes the clerk's office to prepare and process the thing. But by the same token, we're looking at a situation right now where we are anticipating a very substantial loss in county revenue. So when we make concessions like this, are we cutting our own throat? I'm not suggesting one or the other, I'm just presenting this information to the committee because I think it's stuff we need to get thought to.
But if we don't help these businesses out and they close, isn't it hurting us in the long run?
Well, I agree, I'm just pointing this out, I'm not saying one way or the other how what I think about it.
Me and which I have to leave for work.
Is this a list of all the liquor licenses?
And obviously, our liquor
county
licenses are
county put out their own.
not the businesses that are inside any towns. Our liquor licenses only cover the unincorporated bars.
What is it?
I don't see a couple of them on here.
What?
That's because we don't have,
What don't you see on there?
Garfield's
No,
is,
too?
What
Garfield's is
problem?
under the,
Garfield?
They're not in the county,
Towns do
they're
their
in
own.
the town.
Oh,
thanks.
This is
county?
this is people in the county.
Okay. Why don't we select the town too?
What the town does is the town's business.
Yeah, we don't have the authority.
Same thing with here in Watsika. There's several bars in Watsika. They're under the control of Watsika, not the county.
Chopper must be out of the city limits.
It is, yes. Have you heard of any of the villages or cities talking about doing anything in the quorum?
I have not heard anything in that respect, no.
Not in the county, other
Other counties
have.
that have heard?
Yeah, it was Mantino, I think.
How about our esteemed newspaper reporter back there? Have you heard any cities or towns doing anything like this?
So we'll just start it for them.
I'd say you have, because the reality is they're shut down for 4 months no matter what. I mean, at best case, unless the governor changes his mind tomorrow. And then even when they open, they're probably at best gonna be half capacity until we get to stage 5, because that's the only end in sight. I mean, they're not gonna let them, right? I mean,
Possibly, unless the gubernatorial executive order is ruled unconstitutional.
So is that your motion?
okay, I'll move that we cut it by 50%. We should have 50% of their liquor license.
I second.
Okay, is the motion and second on the floor to reduce the fees by 50%?
And issue a refund.
That's for the year beginning July 1st
And issue a.
until June 30th of 2021.
Correct.
They've already paid for this year.
No.
Yes, they
It's
have.
gonna be to give a refund of this year. That's what,
This would actually be, I mean, they've been closed through their current liquor license period, but that money's been already transferred into the, because they paid for their current license last year. So, I mean, this would be giving them a refund in the upcoming year, but we still have that money, I still have that money.
so you've got the money for their,
Yes, because it's due, because their licenses are due to be approved.
so it would be the 20 and 21 year. It's not
Well-
19 and 20, it's 20 and 21. It said it's July to June.
The money that will be, for accounting purposes, that will be in our bank account, we normally put it in the bank right after the county board approves the liquor licenses for the 2021 period. That would be what we would be issuing a refund from, because their money from their last license, once we put it in the bank, we transfer it to the treasurer's office that goes into the general fund. It's kind of just like a technicality, but it would have to be
Every year at the June board meeting, we approve the schedule of fees. I'm not sure when the last time was we increased those fees.
It's been a while since they've been
But
increased.
that might be something in 2021 we might consider.
Nice going, folks.
But right now, we're talking about which, this is preparatory to the June board meeting where we have to approve these fees. So the motion is to reduce the fees by 50%.
Right.
Okay?
Okay.
Anybody else have any question? Seeing none, would you call the roll, please?
Barron,
Yes.
Paul,
Yes.
McTaggart,
Yes.
Awful, Stickler,
Yes.
sure.
Yes.
Okay, next we come to resolution. Appointments. First off, we have an appointment that we'll be making at the next board meeting for the board of review, Ms. Peggy Scheffler. So I'll be on the list, but the one that's more important is the appointment in the county clerk's office. You should have in front of you a resolution declaring the vacancy for the Iroquois County Clerk effective September 10th. I have here the letter of resignation from Ms. Fancher, in case anybody wants to look at it, which was handed to me at after the April board meeting. It's effective September 10th, that will be her last day. What we're looking at here is a procedure that, since we haven't done this very often, this is a procedure similar to what was followed in the Kankakee County Board, I think 2 years ago, 3 years ago, something like that. So the first, excuse me, the first one is the resolution declaring the vacancy. So I would entertain a motion to approve that resolution.
So moved.
Can we actually force her to stay and work?
What'd you say, Mike?
If we don't approve the resignation, can we just make you
I don't
stay?
think so.
I'll second.
She may not show up, but she gets paid, though. That'd be all right.
That'd be okay, yeah.
Okay, is there any, we have a motion and a second, is there any further discussion on the resolution? Seeing none, would you call the roll, please?
Barron,
Yes.
Alt,
Yes.
McTaggart.
Yes.
Awful, Tignott,
Yes.
sure.
Yes. Now, on the other side of the page, there's another resolution wherein I, the county board chairman, will be bringing forth, based upon, in part, on the recommendation of the Republican Party Central Committee Chairman, that Brian D. Suver be appointed to fill the unexpired portion that will commence September 11th, 2020 through November 30, 2020. It goes on to state that the remainder of the unexpired term, December 1, 2020 through November 30, should be 2021, will be determined at the general election to be held November 3rd, 2020. You have to correct that one date to 2021. Is there a motion to approve that resolution?
So moved.
Is there a second?
I'll second.
Motion and second to approve appointment of Brian Suver to fill a vacancy of Lisa Fancher and so forth and so on. Are there any questions or discussions regarding the manner in which this is going to be held? I might point out that according to our understanding of the statute that governs this, I sent a letter to the chairman of the Democratic Party advising him of the resignation and also advising him of the opportunity, if the Democratic Party so chooses, to nominate a candidate for the election in November. So it will be up to the Republican Party Central Committee to nominate a candidate, and I believe it's August 26th that they have until to do that. And the Democratic Party will also have that same opportunity. I believe it's also my understanding that if an independent candidate wished to get on the ballot in November for this office, they could do so by following the proper channels and procedures. Anybody have any other questions about this? Seeing none, the clerk will call the roll, please.
Barron,
Yes.
Alt,
Yes.
McTaggart.
Yes.
Awful, Tignott,
Yes.
sure.
Yes. Okay, we come to correspondence. I got a bunch of correspondence up here. Would you like to pass it around, maybe, please, for me? We didn't have any other claims except this one that he gave me this morning. Okay. I guess he hasn't been doing anything all month. Okay, while you're looking at the correspondence, we'll take a look at the claims, which was handed to me this morning by EMA, Mr. Stacy, for a telephone from Verizon, $68.40. Is there a motion to approve the claim?
I move that we approve the claims.
Is there a second?
It's amended.
I'll second.
There's a motion and a second to approve the claim for $68.40 to pay the telephone bill of the EMA. Is there any further discussion? Seeing none, the clerk will call the roll, please.
Barron,
Yes.
Paul,
Yes.
McTaggart,
Yes.
Awful, Stickman,
Yes.
sure.
Yes. Old business. Is there any old business to come before the committee this morning? Is there any new business? Seeing none, is there a motion to adjourn? Mr. Alt, you're not sleeping. Is there a second? Mr. Ticknott seconds.
We did. Okay.
All in favor, aye.
Aye.
Approved, same sign. We are adjourned.